Welcome once again. I'm Dr. Pauline, the Director of Chaliana Medical Center, pediatrician by profession, having a comprehensive working experience in both public and private hospitals for 7 good years, and having a lot of dedication and passion towards kids. Welcome. So today we are going to discuss about hyperacidity in our children. So you need to ask yourself, how does hyperacidity come about? So hyperacidity in children, you get to know is acid reflux or gastrointestinal reflux disease. In most cases, you get that it can cause discomfort and various symptoms. How does it cause discomfort? Because they start reflux of the acid, and when it happens repeatedly, you get that there's an ulceration being formed. And it's unfortunate most of the caretakers, parents, and even mothers don't understand how does it come about. Mostly it's about the kind of food we do introduce to them, especially the food which has a lot of maybe spices, and maybe some of them has a lot of acidity in them. So as a result, the child can experience abdominal pain. The child can also experience diarrhea. Sometimes the child can experience inability, a poor appetite. Okay, at the same time, the child can be irritable because when you try to feed the baby doesn't want to feed. Simply because when you feed a certain food to the baby, it aggravates or it worsens the stomach contents, whereby there's a reflux of it. And once a reflux happens, there's a lot of irritation to the ulceration or to the wound being created in the stomach. And that's why we need to be very cautious what kind of food we give to our babies, especially if I can talk about in the coastal region. Most babies are being introduced with viazi karai. Viazi karai ambapo sinawekwa pilipili, maybe kunayo ukwaju, na mtoto is being used to that. Now, with frequent use of that, you get that the stomach clearance is a problem. There's a lot of hyperacidity. Remember, when there's a lot of hyperacidity being produced, so there's a lot of effect to the stomach lining of that baby. And that's why the discomfort comes about, irritability comes about, vomiting comes about. So we need to understand what are the factors. What are the factors about the causes of hyperacidity in children? Number one, we have said is about dietary factors, as I have explained. Taking a lot of spicy food, carbonated drinks, or sometimes getting larger meals, which can trigger acid reflux in children. Sometimes these children, we need to control them on the quantity they need to take. So that is number one factor. Number two factor is about obesity. How does obesity increase acid reflux in the baby? Now you get to understand that excess weight can put pressure on the stomach, leading to acid reflux. So due to excess weight added to the baby, now compressing maybe to some of the organs, can lead to acid reflux. Number three is about hiatus hernia, a condition where a portion of the stomach protrudes into the chest cavity. increasing the risk of reflux. So when you get that one, you see those signs, kindly bring the baby to the hospital and they get treated. Another one is about delayed emptying of the stomach. Some children have this habit of having delay emptying of the stomach. It could be of one or two reasons. And reason number one, some children may have a condition where the stomach takes longer to empty, allowing more time for acid to accumulate and to reflux into the esophagus. Now, sometimes you get some foods we give to the baby, especially the soft food. Ama hii sasa kuchujwa saa yote yani. Soft food. Yani lazima umtengenezee kwa yani soft sana. Haina fiber, haina ile nyuzi ambayo inasaidia kufanya digestion ya mtoto. So as a result tunapata kunakuwa na delay emptying of those contents. When the more it delays, the more the acid also increases. And that's how the hyperacidity comes about. And that's how even constipation comes about. And that's how with time, because when the baby goes to the toilet, he strains helping himself. So with strenuous, with consistent strenuous activity of emptying the stool, you get this some muscles which are being strained, and those muscles you get that they protrude outside the anal region, and that those muscles you get with what we call in English a medical term hemorrhoids. It's very discouraging for a young kid to start having hemorrhoids because if you cannot prevent it as early as possible, it can bring more complication later and it's going to cost you as a parent. Another cause is about certain medications. Some medication can weaken and lower esophageal sphincter, which normally prevents acid reflux. I think to that point, we are able to understand what is hyperacidity, what are the causes, and now we need to know. We have also discussed about the signs and symptoms. We need also to know what are the treatments of those conditions. So the treatment, first of all, it's about dietary modifications. We need to increase more fiber to the diet of our children. Number two, we need to increase intake of a lot of water. We need to encourage our children to have a regular emptying of their stomach. That also goes hand in hand, even emptying of the urine, because if it stays for long, it brings also infections like UTI. Number two, we need to do what we call positioning. Keeping the child upright for at least 30 minutes after meals, especially a child who is 0 to 1 year, can help him not to have such kind of reflexes. Another way is just medications where we need to give antacids. That is proton pump inhibitors, H2 receptor antagonists. Okay, in short, we are talking about antacids, which we are going to introduce to our babies. So antacid, we have various varieties, but with me here, I have Foresa whereby you can give it to your baby when he is having constipation or hyperacidity. It's going to help. Also, we have what we call Nilazid. The one you are able to reach at, it's also good. And sometimes you can get the babies younger and breastfeeding, like that is less than 6 months. The probable one you can use is this one, neopeptine oral drops. So when you give it to the baby, you get that there's no further constipation or gas reflexes. And to some extent, because already the normal flora of the stomach has been affected, we need to introduce what we call probiotics. Probiotics, in one way or another, so it helps to replenish the normal stomach lining. As I told you here, this is one of the probiotic, Tecospora, readily available. You can get them at 10 chemists. And not only this one, we have several of them like Floranum, Novajamina. So if you get any of those, you can go and buy for your baby so that he or she can use. Thank you. Once again, pause. Another point on how to control that is about monitoring and following up on the checkup with a pediatrician. Here I'm the pediatrician at your reach. Kindly follow up for more information because I can advise you on now to take care of your children well and also to have a good exercises and good routines for our children. Thank you for watching. Kindly comment, subscribe, and be ready for more videos.